Authority to grant creative Thomason. I serve as chair of our grants committee. Following grants committee members are in attendance, as you see in person: Sharon Buckman, and Tim Spencer, and Mike Tillum. So thank you guys for being here. We do not have other members virtually that I'm aware of, but we do have an in-person forum. I would also like to welcome everyone who's joined us in person or virtually. We have our new board member, Debbie Bitter, that's here with us, so welcome. And I think you have someone with you, David Westcott, is that right?
Yes, yes.
So he's joining as a visitor from the city of Chesapeake. Anybody else we need to acknowledge? Because that's all of us, okay?
Be a great,
Oh.
secretary.
Hi.
Hey.
Mark is here representing the secretary. Thank you for always being with us.
Thank you. Miss.
All right, so if we can go on to the next slide, our agenda, we have item number 2, and that is for us to consider a motion to approve the February 21st, meetings as they were posted on the website. Remember, they're always posted there for us to review. Do I hear a motion to approve the minutes?
So moved.
Thank you. Do I have a second?
Second.
All in favor, please say aye.
All right.
Unanimous. Next agenda item is for us to receive an update from our executive director, Tony Alta.
Thank you, Madam Chair. I'm actually going to, the purpose of these comments is to remind the meeting what the financial resources look like going into your consideration of these recommendations. Because obviously you have to understand what the guardrails are, how much money is available, and we have to balance the rewards we'll make today with the long-term needs for the Commonwealth. And so I'm going to ask our Director of Finance, Adam Rosatelli, to run through the several slides, provide you with that update.
Okay, thank you, Tony. So, Madam Chair, I'd like to transition then to a review of the financial plan for city and county reg awards and the committee recommended award totals. So beginning with the individual distribution and gold standard award totals. So total of approximately $4.4 million is being recommended for award statewide. So this amount provides funding associated with 53 applications of cities and counties. So quickly moving on to the Operation and Stop Awards. So as you know, these were targeted grant opportunities for select cities and counties whose populations experience a disproportionately high number of overdose deaths among African Americans. Total $3.5 million is being recommended for award among the 7 cities and counties total identified, with most awards recommended at the $500,000 level and one of Newport News at $360,000. Also included in this recommendation is $155,950 in individual distribution of gold standard matching funds as depicted in the bar chart on the slide. So moving on to the budget and award totals for cooperative projects. And just to remind the committee, so each regional cooperative project budget totals are calculated to serve as a guide, meeting the OAA statutory requirement to equitably budget for the distribution of funds throughout the Commonwealth on a long-term basis. The budget for cooperative projects statewide, including the use of unrestricted funds, totals $24.7 million. This funding is associated with 58 cooperative partnership applications, of which 29% of that funding is associated with new applications, while 71% is associated with renewal applications for previously awarded projects. So this is just a high level view of all the funding that's being recommended for award. So this includes all the cooperative projects, individual distribution awards, Operation Stop awards, and all individual and gold standard funds applied toward applicable projects. A total of $32.6 million is recommended for award. Of the regional totals, the Southwest region accounts for nearly 37% of the total, followed by regions 1, 4, 5, and 2 in descending order. And Madam Chair, that concludes that brief overview of the funding amounts allocated.
Delegate Sewell has joined us virtually. Welcome. I'm glad you were able to join us today.
Thank you for letting me participate remotely.
We're gonna move on to agenda item number 4, have the update from our Director of Operations, Charlie Linnegan. Charlie, over to you.
Madam Chairwoman, Council James Leisman, just so that's clear, for the record and pursuant to FOIA, when somebody participates remotely, I believe the reason that Delegate Sewell's participating remotely is because her residence is 60 miles away from the place that we're gathering. If she could confirm that, then the minutes will be clear on that.
Yes, that is accurate. I am currently more than 60 miles from our desired location due to death in the family.
Thank you.
All right, thank you, Madam Chair. So, a lot of stuff to cover today. I will do my best to move through it efficiently as we can. Next slide. So, first off, I wanted to start off with a review of the 24-25 application cycle for cities and counties. Application period opened October 1st of 2024, closed April 1st of 2025. Through that time period, we received 132 total applications for funding. That does not include additional applications for gold standard opted. We had 2 meetings of the grants committee earlier this year where we approved some awards in December and February, so noted. And then today we have 118 applications for consideration. So, and all 118 came in probably between mid-March till April 1st, or a few days after due to some technical system issues. Mid-March maybe slightly kind, but anyway, as always, everybody's got a lot on their plate and getting some of the things as they can, so. But they did everything, all these applications came in through the grants portal this year, through our online portal. So, next slide. So this is a look at how the applications are kind of spread out across the different Department of Behavioral Health and Developmental Services regions. For this year, you can see the first one is our renewal of individual distribution awards. The second, the darker blue line, is new individual distribution awards. Then the kind of light teal third one is the renewal of cooperative partnership awards. The fourth is new cooperative partnership awards. And the last is the operation stop, which we'll only see in regions 4 and 5, because that is there are only 7 localities eligible to apply for those months related. But you can see region 1 picking up quite a lot of steam in that area with applications. And so here's another way just to show across that this is the same kind of information, but this is by the percentage of applications we got per region. Region 1 is got 32%. Region 2 has 7. Region 3 is 22%. Region 4 is 15, and Region 5 is 24. Now, that doesn't mean that some of these are very easy and simple individual projects. They're maybe not even work through. Some of these are very, very complex cooperative partnership awards. And while the Southwest region has been ahead for some time in their applications, many of them are very complicated. A lot of the ones that have been added to the Western region or Region 1 this year have been a little more straightforward as we brought some more localities. So just because there's a higher number doesn't mean that there's not more work in it. All right, next slide. And here I wanted to show just a comparison by the DBHTS, comparison by the application types across years. So as you can see, we had 47 applications in 2023. Our initial application period that was July. That was January through May, I believe, and then 2024 was October to April, as was 2025. So in a little over 26 months since we opened our very first grant opportunity, we've received 333 applications. or funding and or gold standard opt-in. So quite a lot of engagement from the cities and counties, and quite a lot of work by our staff. All right, next slide. So we are now at 65 cities and counties that have opted in for the gold standard. And and we are up from 37 this time last year, so it's a 75% increase, which is very good. A lot of work from our newer outreach coordinators has really helped with that. Currently, 48.9% of all cities and counties are now participating. We do know from conversations that a few have not signed up to opt in because they have a large amount of individual funds and they haven't spent those down enough to need to add to the gold funds, but they intend to in the future, and we will still keep working, trying to get everyone on that. All right, next, we have the standard contingencies, OAA contingencies for our awards. So this is things that usually happen after an award is made, before funds are transferred, or things that need to happen along with an annual report. There are things that we don't have these cities and counties engage in until they know they have an award, because it may take quite a bit of time. Financial staff, program staff, legal staff, those types of things. So our first one is new for this year, which is ensuring that the fiscal agents will be assuring that they are subscribed regularly and are regularly reviewing the contents of our news update newsletter, which is our primary form of communication for requirements, due dates, instructions, guidance, and all of that type of stuff. We had a lot of communication that people quote unquote didn't know about some dates of things happening this year. And I'm like, what do you have to do? So they said, yeah, yes, but I didn't look at it. Okay, well, let's make sure there's a clear understanding that this is the primary way we communicate with you when these things are coming out, and making sure that they're checking. For new projects, if there is a subrecipient, like a nonprofit, a service board, health department, contractor, that's going to be receiving the funds from the locality, we ask for a written agreement that's executed before we transfer the funds. For renewal projects, if they have funds that they're carrying forward from the current year into the future year, they have to complete what we call our true up process. So once the year is over, we find out where did you end up, how does that affect what was approved by the grants committee based on your estimate. And then if they have a lot of funds that they're carrying forward and they've got some new funds coming, they have to encumber 80% of what they currently have before we transfer the additional funds. We're trying to minimize transferring funds that are just potentially going to sit in a locality for 9 to 10 to 12, so sometimes carried over yet again into another fiscal year. For new cooperative projects, all new cooperative projects are required to complete what we call an operational agreement. This is the agreement amongst the partners, cities and counties, about who's responsible for what and how everything's going to operate. If they have subrecipients, the fiscal agent has to add that agreement that I mentioned earlier as well. Those are separate. If we have a capital project, we have some kind of capital cost agreement that if it's a large capital investment, they have to sign an agreement that they'll maintain the approved use for 15 years from the beginning of the grant before we will transfer the funds. In all renewals, we set kind of an internal budgeting cap based on a formula we have based on their applications, and that they acknowledge that that is the amount that if they are compliant, that they're not really competing for. If they want more than that cap, then they're competing for the delta. So if they have a renewal cap of $100,000 and they want $120,000, they're competing for that $20,000 additional each year. And the next slide is some things that are specific to specific types of grants. If there's a large amendment that comes through to a process, then we require them to update their operational and or their written agreements with subrecipients. If they have a large bit of what we call non-OAA matching funds. So in some terms, non-OAA matching funds are things like their direct distribution of their general funds. We're not as concerned about that. They have control of those funds. But if it's with a grant or say something that's given by a community organization to them, we're looking for a letter, a check deposit, something like that. to ensure they have those matching funds because we're making our award, assuming those funds are secured and covered. Have to provide finalized copies of any request for proposals. If they have a very large project, some projects start off with capital in their first year or so and then move into operations. Sometimes that capital doesn't go to plan, the capital project. So we're starting a process this year where we're gonna transmit 50% of the award up front. And then once they have can show us that they have basically completed about 1/3 of their project's objectives and milestones, and they've encumbered that 50%, then we'll transfer them the other 50%. We have some projects that have had money for 2.5 to 3 years that they're still working down that we could have held here and possibly, you know, and maybe they didn't end up needing some of it in the long run. For harm reduction projects, there are some approved abatement programs that are related to drug checking services. And we want to make sure that any awardee that's using that is adhering to the various sections of the code. And that this drug checking is only for approved opioid abatement services and not for the benefit of drug dealers or sellers to third parties. There are some special grants that have things that they're doing that are that you can't really capture until the end, and they don't fit in the idea of a performance measure. So that gets added as an attachment to their annual report. Data gathering projects, especially for mapping services, are to be shared between 211 and 98. There's a 1-year pilot project that we have awarded, which we have one this year, that the performance of both fiscal agent and subrecipient will impact the decision on the ability to renew and or increase funds in future years. OAA awarded funds and or projects shall not be used for or connected to legislative advocacy efforts throughout the Commonwealth. And we have some projects that are competitive that come through with only 1 year of funding, which is fine, but those projects have to understand that in year 2, they are competing again and they don't have a renewal amount because Adam doesn't have an amount to project to encumber for the future years. So there's the dry stuff. Now, individual applications, individual distribution amendment and renewals. So we have a large list here. It's certainly an eye chart from where we're sitting, but it is attached to your agenda. It was sent out to everyone earlier, and so you can follow along. It is in the same order for the most part as we go. So these projects are all projects that were approved in 2023 or 2024 and are compliant and moving on through their renewal. So I'm not going to belabor a description of each of them. I will note a couple of things such as you've heard us talk about I think that's on page. That's my thought. Thank you. Right. Apologies. Some of these programs were, you may see have a large amount of carry forward. Those are all the projects that were approved either in December or February of this grant cycle. And so sometimes they end up having delays in either final paperwork just before we can transfer them to funds. And the project starts a little later, so they end up carrying that award forward. But they can basically hit the ground running as soon as they get approved to do that, as they've already got the funds.
Charlie, if I could just make a comment.
Yes.
Madam Chair, one of the challenges that we've had with the reality of these grant programs is that we'll get an application from the city or county, whether it's cooperative or individual, and it's a great project. We bring it to you, you approve it, we transmit the funds, and then there's a time lag for the recipient to actually get the program up and running. And this is, I think, really should be expected because everything that you're funding must be new. or it must be an expansion of something that already existed. So now you've got a locality that's doing something completely new, and they might have partners that they're working with. And it takes time, and sometimes it takes a year, year and a half, or longer to get up and running. And so what is encouraging for us is that we're seeing projects that were approved 2 summers ago that are just now getting up and running, but they are up and running. It's been a challenge for Charlie and his team because we have to keep track of all that money that hasn't been spent and what to do with it and to carry it from one fiscal year to the next. And that's part of the reason why Charlie renewed so many of these contingencies. Because we have to be good stewards of these funds and not lose track of them as they're moving forward. But just understand going forward, I think that it's not gonna change. As we bring on new projects each year, there's gonna be a delay
Mhm.
in the implementation of those projects. And so it's been a learning curve for us to see what this looks like. And it's not always true. We've had some localities that have been able to begin immediately and have spent all their funds, but we're not trying to torture you with all these charts, but this, what Charlie's showing on page 2 includes not just what's being recommended, but what's being carried forward. And so ultimately, that's critical in that.
Madam Chair, this is Senator Pillion. I have a question on that for Tony.
Yes, sir.
Okay, so is there anything that we can be doing to expedite that process where you said some counties are more efficient or not necessarily more efficient, but have gotten up and running quicker than other counties? Is there something that we see internally that we could help with, or that maybe in the application process that we could have prior to distribution of funds, or prior to this, you have to have these signatures from the county, or you have to be at this point of agreement with your partners? Is that something that we've looked at, or that we see that we need to have them working with us to improve that process to prevent the length of time before the actual launch of their program? Or is that just something that is going to happen because of the complexity of some of the grants that we're issuing?
Yeah, that's a great question. It's one that we talk about a lot. We try to address it from a couple of different directions. One is through our requirements, and we require certain things to be accomplished in a certain order. You know, all of these applications, when they come in, they have to be signed by the chief executive of the locality. So that's typically a county administrator or a city manager. And so we have tightened up those rules, and that is assisted. But what really seems to make the biggest difference is the work that our outreach coordinators are doing. And kudos to Kat and to Jenny and to Cindy. They're on the ground, geographically located close to the recipients, and constantly following up in person, on phone, to help, to provide assistance, and to, you know, sort of be a taskmaster as well. And so we're actually going to be in the next meeting today, we're going to be asking the full board for support to bring on a full-time abatement coordinator, because I think that's the biggest opportunity we have is through that customer service piece. There's always going to be some local politics that, you know, are inevitable, that in some cases we can help, and in some cases we may not be able to help. But if there's anything we can do, we will.
Yeah, because to follow up on that, the last thing we want to do is make the application process more burdensome and discouraging to the localities that may be applying. So, but it sounds like you are doing everything you can to expedite that process and to get those funds and the implementation of those programs happening. I just, as I always say, you know, the money does no good if it's sitting in our bank or somebody else's bank, the Commonwealth's fund. It's meant to be distributed and effectively used, and anything that we can do as a team, we definitely want to do, and it sounds like we're doing that.
Yes, sir, we hear you loud and clear.
So,
Apologies to assert myself again. Now that Senator Pillion has joined us, if we could have the minutes reflect that he is attending virtually, and if Senator can confirm the reason that pursuant to FOIA, he's attending virtually is that his residence is greater than 60 miles away from the intended meeting place of this meeting right now. Is that correct, Senator?
That is correct. I'm rapidly approaching the 60-mile mark. But I am further away than 60 miles presently and will be for the entirety of this meeting probably. So yes, sir. Thank you.
Thank you, Senator. Thank you, Madam Chairwoman. I apologize for the interruption.
Thank you.
All right. Well, so to the left of the slide here, I've put together kind of the summary by OAA region. So our OAA regions are laid out a little bit differently than the DBHDS regions, and that is to try and make travel for where how the counties are located along major highways a little bit easier than the way DBHDS lays things out. So the individual ones here are organized by those regions. So the OAA Central Region, which is currently our vacant spot, that does not have a coordinator, 11 renewals with a total recommendation of 547, 744. That's new money for FY26 as well as FY25 carry forward amounts. For the OAA's headquarters region, which is kind of tag team by those of us in Richmond, and it's only 6 counties: Henrico, Chesterfield, Richmond, Charles City, and New Kent. We have 5 renewals totaling 534, 540. Do any members have any questions about any specific projects that are listed on this? And that's the page 2 of attachment A.
And Madam Chair, if I can jump in again, apologies. You know, in previous years, we brought you a summary of each one of these grants. We've got too many.
Yes,
The
590 pages if I printed them all.
But what Charlie's done here is he's provided in the PDF that you received by email. Each one of these, as he goes through all of these, each one of these grants has a hyperlink. And if you click on it, it'll bring you in through our new system. Will give you all the project details.
Yep.
That way you don't have to have 600 pages of documents.
Yes, and that's the way it's posted online on our website, as well as in the Commonwealth calendar for this meeting. So trying to still get all the details out there to maintain the transparency and not kill a ton of trees in the safe process. So on to page 3 of attachment A, we move to the eastern region that has 11 renewals, total recommendation of 1.193 800. And then northern region, which is 8 renewals, recommendation of 798 319. Again, this is inclusive of carry forward as well as new funds for FY26. Do want to highlight 1 or 2 items on here. We've got, if you notice, there's a lot of counties that have got multiple projects. Gloucester County has 3, Virginia Beach has 5. They originally had 6, but one of them was only a 1-year project. So there's a lot of engagement coming along with these items. So, and some of them have added more projects this year as well. Any questions about any projects on this page? Right, and then last on individual distributions, we have the Western district, which is Cindy's area. I apologize to the Eastern is Ginny, and Northern is Kat for contextual purposes. Here we've got Roanoke City and Roanoke County both doing a number of items, and then along with Smithwood, you'll see a lot of recovery support going through these, and we would have some more new. That's a very common use of people have done either to stand up, to add some operational capacity, expand, or to pick up operational costs where a BJA grant has, it was designed for setup has expired. So total, so 6 renewals for the Western region, 503, 283, total of 41 renewals, 41 separate projects that are just being done by an individual city or county, with the total recommendations of about 3.5 million. Any other questions on the renewals with individual distributions? Next slide. So new projects for individual distributions. So first we have to see Henry County and Martinsville's project is titled the same. We've actually seen this kind of individual application come in another place, a couple of other places. Where they are basically sharing the cost of a kinship navigator position through their shared social services division through separate individual distribution applications. So that's what they are working in partnership. Henry County is ultimately the fiscal agent for the social services, combined social services department. So they will be administering the funds, but they will separately apply, and they have aligned their goals, their objectives, and have kept their performance measures separate by the amount of the county residents that are expected to be impacted versus city residents that are expected to be impacted. The next two you'll see are Chesterfield County and Richmond City. While they have similar titles, they are not, they're not a coordinated grants, they're just similar in style. So both of them are doing sub grants or sub awards. So they're getting money, they're putting out like a request for proposals for abatement type purposes to different organizations. So Chesterfield is sending theirs out to their internal Chesterfield County agencies to come up with projects that they can do. The city of Richmond is going to be giving the money to nonprofits with some data involved about areas of highest need being addressed by those projects. And both of those will have a contingency to require a detailed report along with their annual report. It kind of tells us how did the decision process go, how are the funds being administered, and what are the projects ultimately going to be. Next, we move into some of our more public safety related. Nelson County is a jail-based Sublocade medication for opioid use disorder pilot project. This is now the third individual distribution application for the Charlottesville Albemarle Regional Jail. Is that the right term name? Did I get it right? And Nelson County is also part of that regional jail. And so Charlottesville has an individual that's supporting this. Albemarle has an individual that's supporting this that are both for renewal that are just covered. And now Nelson is joining as well. And why are they doing this? Cost is not very high, and they all have individual pots of money that they can use to cover this amount of money. And this allows them to leave the competitive dollars in their regions available for larger projects that can have larger reach. Culpeper County is their doing a support for their recovery court. This was established with a BJA, Bureau of Justice Administration, Adult Drug Court grant. It was discretionary, and that grant is existing funding will run out at the end of September. And since that will not be no longer available, we are picking up the operational costs and allow them to add some capacity to that. So this is one of those areas where an ending of a discretionary grant, we don't consider it to be supplanting like we would if they were just deciding to stop using general funds for something. This is why would we spend money to reinvent the wheel when it's a project that's already works? But as part of that, there's always an expansion and additional service that comes along so that it still meets the qualifications of the statutes. Next, we move to a couple of projects from Warren County. All of Warren County's projects thus far have been focused on youth, primarily high school age and middle school age students. So the first is a summer camp for middle-aged youth to build resilience and prevent drug misuse, focusing on balancing education, skill building, mentorship, and fun. It's got 4 core pillars. Evidence-based process, and this is really to kind of keep them engaged around, healthy decision-making, healthy risk-taking behaviors during the summer while school's out. They do have a full year-long student center that they run a number of programs out of as well in addition to this project. And then they also have Project Hopefulness for opioid prevention efforts. Evidence-based strategies that are combining prevention, education, harm reduction activities to keep youth from initiating illicit substance misuse with an emphasis on opioids and fake pills, building resilience to individuals and the community to help overcome poor health outcomes across the population associated with adverse childhood experiences. So this will look at things, use programs like Too Good for Drugs and Bond and Life Skills, and ensure that if there's any opiates in the home, that they are secure and safe, and focus on an understanding of the long-term impacts of adverse childhood experiences. Next, we have Henrico County. They're doing an outreach program that is concerning addictive behaviors in adolescents. This is looking at trying to understand the balance of various substances, not only opioids, but things like tobacco and marijuana, being connected to things like opioids and other illicit drugs in the adolescence age. Frequent users are more likely rather than less likely to escalate to an opioid use disorder if they're using other illicit substances. So it's focusing on prevention on a broad scale and trying to get with healthy decisions earlier so they don't potentially increase their risk early on with things that seem to be less, that they may have a social opinion of being less bad. And then Fairfax County, the Fairfax Falls Church Community Service Board has provided medication for opioid use disorder to adults 18 and older for several years, but in response to the rising number of non-fatal and fatal overdoses among youth, they are initiating a youth medicated assisted treatment expansion, YMAT-E, project, and this is going to enhance services for youth diagnosed with opioid use disorder, expanding the age range and addressing significant shortages for these types of services in Northern Virginia. And I haven't done the math, but it's between their individual and gold standard funds, $1.1 million. This is probably going to be our largest individual project awarded to date. Another Henrico County project, we'll have them placing naloxone distribution boxes in 2 libraries, as well as some things in their 4 locations for their community service board, and they'll be partnering with Virginia Department of Health to do that. And then lastly, on the new individual awards, Prince William County is going to be looking to hire an opioid response coordinator, trying to, ensure a comprehensive data-driven and effective approaches to addressing opioid misuse across the greater Prince William County area, coordinating all of their efforts, and will oversee design and implementation of their targeted strategies, including use of OAA funds. That currently this has been handled by a smattering of people across their community service board, with each person kind of taking a piece, making it a little hard for one person to bring everything together. So I think this will be a good win for them. So that is the individual distribution new award recommendations. Are there any members have any questions on any of those projects? Okay, and it looks like our total 12 applications, covering just about $2.2 million in work. All right, now we'll move on to our summary of cooperative partnership applications. This is for renewals and or amendments. Next slide. A little hard to see from this distance, but on the left towards the top, you see those are the Department of Behavioral Health and Development Services regions. And then on the right are the OAA regions. There's a lot of overlap. Pretty much all of the eastern region is with our eastern region, but some of our eastern region flows into the DBHDS central region. For the purposes of the cooperative partnerships, they're going to be in Department of Behavioral Health Developmental Services order because of the equitable distribution that follows along with that. So start out with DBHTS, Region 1, we have 11 renewals of the total recommendation, $7.7 million. That includes carry forward, that includes, new funds, new capital funds for, 2026, as well as if there's any unrestricted funds. So if there were a few projects that were, when they were initiated, they were recommended to be funded out of, the board's unrestricted funding bucket due to a budget balances, and most often we do that with big capital projects. And so once we started a project with that funding source, we want to maintain it. So there's two projects, Lynchburg's adult detox program, which has a very small award at this point out of unrestricted because they're finishing up their renovations and moving into a couple of years of operations costs, and the Allegheny County, one-stop, SUD continuum, just going into its second year. And it's basically capital for purchase and renovation of the facility. But this project, most of these projects that are funded out of unrestricted are short-term. They're not usually running the whole 5 years, or the out years are very minimal operational, costs. Are there any questions on any of these projects listed? This is, we're on page 4 of attachment A. The first block for Region 1. Right. Next slide. Now, DBHTS Region 2, this is the northern area. CAT covers this entire area. They have 2 renewals, recommended about $1.6 billion. There is the only one receiving actually new funds for FY 26 is Prince William County for their OAA program. And the reason there are so few applications cooperatively here is the Fairfax County Residential Treatment Program, adolescents, some of you may remember, has been deemed by all the localities in that region 2 as their top priority project. And it has unfortunately had the slowest stand-up process of any project, not to the detriment of efforts by Fairfax and all of their partners. They had to go through multiple requests for proposals to try and finally identify a vendor who would come and engage in the services. And happy to report, and after the board meeting, I'm sure Mr. Washington gets there, be happy to talk to you about it. They have awarded the contract. And we have worked with them to figure out what they actually need going forward, because all of the locations bring a substantial match. So that's why you only see a small amount of carry forward going forward in, which is Representative Fairfax's individual distribution, contribution to the project. But we do expect much higher awards in the subsequent years, and probably them coming back to re-up for another 5 years after their first set of renewals has been exhausted. But we're very happy to see this moving along, and they will be able to accept patients from all over youth from all over the Commonwealth.
Charles, do you remember the number of beds specifically?
It's going to start with 16. This version they were able to get to. I think there's hope that over time, by the time after they get a few years of this first contract out of the way, that they may be able to add onto or move to another facility that will be even larger. So, but I believe 16 at current.
So these are medically supervised, licensed inpatient treatment bed
For youth.
for children and youth.
And one of the requirements around youth and adults cannot be mixed. They have to be separated. So it's often a lot of something that gets kind of laid out and set aside because you can serve so many adults, because they can be mixed. But Fairfax's team has been very forthcoming, very collaborative with us. We probably talk to them, if not once a month, definitely every other month as they go through, and have really worked hard, and I think they're all really ready to get to work on this one. So DBHTS Region 4, that's more of the kind of traditional Central Virginia area, kind of Henrico, Hanover, Richmond, down to the southern border. These projects have been in, some of these projects have been in place since the first year of the project. Recover and pregnant parenting women Chesterfield's mobile outreach, which is still had a bit of a slow going, so getting up and going, but has now got some good legs to it. And then Richmond also has their resource mapping of resources. So that is 4 renewals, $2.4 million. Any questions on these? Okay. Moving on to page 5 of attachment A, which is TVHTS Region 3. Cindy covers most of this, but part of this is in that uncovered central area. So we have tag teams working those applications across most of the staff. Let's see. There are 3 projects here that are also with this unrestricted funds, Appalachian Center for Hope. That was awarded out of unrestricted funds for budget reasons last year. It's also capital, also one of those projects that I believe after this year will be done with OAA, money for OAA funds that'll be self-sustaining. Same thing with Wildwood Health Wellness Center. That money is, the unrestricted is a combination of carry forward and new awards. So they are just trying to wait to get their invoices in place, and then they will probably actually expend everything before the end of the fiscal year. But at the time the application was due, they were still trying to get things squared away. But once that is done, that'll be a self-sustaining operation as well. And then there's the Roanoke City Restoration Housing, which was capital in nature, and it is moving operational at this point.
Operational and third minutes.
Yes, it's not as high of an ask for this year, and but we're just maintaining the funding source. Going forward with that. And Montgomery County still tends to be the largest single cooperative project with their opioid recovery ecosystem for the New River Valley. They're doing lots and lots of things, so much so we had to meet with them and kind of map it out, so we made sure we had an understanding of like a flow chart of who all the organizations are, how the counties are, and how all the money's flowing.
How many, Cindy was telling me last night how many sub-recipients?
Yes, upwards of like
19.
well, it's like 15.
15, I was thinking, 15 organizations outside of the Montgomery County, and it's like 5 partner other counties.
And they go all in with direct. It's all go
Yes,
back to their-
lots of match funds. Well, that's, so. 12 renewals, $11.6 million. Still, some of the largest and best projects are coming out. Best put together projects are coming out of Southwest Virginia. Any questions on these renewals? Okay. Now we move to page 6 of attachment A. DBHDS Region 5, 8 renewals for a total of about $5.5 million. Chesapeake is still carrying forward some funds related to their inpatient psychiatric unit construction. That is well underway. There were some grant funds that had to be spent first because they expired sooner than the funds that we had awarded to them. But they do anticipate those funds being exhausted this year, and I believe scheduled to open in January. Yeah, that's what I thought. So once that project is done, it's going to be self-sustaining, need additional operational costs. And probably another highlight, Virginia Beach's mobile van for primary care SUD, which is a partnership with Centera, who's bringing a significant amount of in-kind donations to the project. They just had some delays with getting things together to be able to get the mobile unit purchased, but that is so they're carrying it forward a lot, but they expect to have everything up this year. Any questions on the Region 5 renewals? All right, so that's a total of 37 cooperative partnerships up for renewal. Recommendation of $28.9 million in annual awards across matching funds, carry forward, U-26 and Michigan. All right, now we move to new cooperative projects. Spot. There you go. So. We're on page 7, attachment A, Augusta County. This is a regional prevention, education, and harm reduction service. And so this application came out of a regional planning grant that OAA awarded in 2023 to Waynesboro, Stanton, and Augusta. And so this is the result. Once they, for a reminder, when we did the planning grants, not only did they have to develop a plan and provide us a copy of it, that plan had to turn into an application to us for funding. And so that's what the results of this is. It's going to be preventing first-time opioid misuse, encourage help seeking without fear of stigma, educating vulnerable populations, strengthening collaborations through harm reduction, improving connections to recovery support services. And will include a substance abuse prevention coordinator housed in Waynesboro's Office on Youth, and a nurse navigator mobile clinic and with community health worker through the Central Shenandoah Health District. Clark County, which is a first-time applicant as a fiscal agent. Teen mental health first aid project. They're working in partnership with the Community Service Board to provide the mental health first aid for 9th grade students. It's an evidence-based program. They hired an employee to coordinate the program, provide training to trainers to schools. Schools provide the instruction, and there is some of this provided at the schools, but it is intermittent and not coordinated, and it's not a full-time funding support. So this will make sure that this gets some more steady funding around the support of this program, so that everyone coming to the 9th grade in those communities, stay along with Warren Page and Shenandoah are able to get this trained. And we have another award that's around mental health first aid through Virginia Tech through the cooperative extension, where they are doing something similar. So we've asked them to kind of work through and partner with them to see if there's some partnerships they can make there to help with some long-term sustainability. Next, we have Waynesboro City River Ridge Learning Center, which is a recovery high school. That is also for the Stanton, Augusta, and Waynesboro area, Saw region, as they are referred to themselves. So they were a sub-recipient of a planning grant that started with an OAA award to the Department of Behavioral Health and Developmental Services to help identify the potential next locations for Recovery High School, and they applied and were able to get it and put their plan together. So this will help fund part of the startup, and so it's going to provide high quality education for students recovering from substance use and co-occurring disorders. They'll award state recognized high school diplomas, ensure all students are actively engaged in structured recovery programs and support distance-based focused approach to sustained recovery. And so recovery high schools have to have, they have to be a school and they first have to be a clinic. So they have a lot of Department of Education regulations follow, as well as Department of Behavioral Health Services.
Charlie, if I could, Madam Chair, if I could interrupt just for a moment. So I think most of the folks in the room are aware that the first recovery high school, first recovery academy in Virginia is fiscal agent is Chesterfield County. And they draw from a region that encompasses most of Central Virginia. The General Assembly, not this most recent session, but last year, provided additional funding to start up 2 more recovery high schools, one in Loudon and one in Virginia Beach. Each of those would have a regional draw. So the effort that you see being driven by the localities in this area right where we're meeting right now, so the partnership includes Waynesboro's fiscal agent, but also includes Stanton City and Augusta County. So they're being proactive by using their local money as well as applying for OAA funds to do the same model that has been done in other parts of the state and to do it here. But particularly for the members of the grants committee, it's important to understand that I think it's entirely likely that state legislators from this geographic area are probably going to seek additional funding from the General Assembly going forward to support this. And so we've been very clear with them that we base the project decision that we're recommending based on the OAA application. But it does not mean that they have a leg up with the General Assembly. And so that's a separate issue it's a separate train on a separate track. I wanted to call that out so that they're really in the spirit of disclosure.
Thanks, Tim. Next, we'll move into the HDS Region 3 or Southwest Washington County. This is the Brighter Paths, Building Social Emotional Strengths for a Substance-Free Future. Washington is working with 1, 2, 3, 4, 5, 6, 7, 8 partners. I think 8 partners is our largest. We have one other 8 partner project that is also in Southwest Virginia. They are aimed at introducing new efforts to discourage and prevent misuse of opioids, evidence-based methods, programs, and try to help mitigate these issues in Southwest Virginia. They're going to establish partnerships with direct partnerships with regional nonprofits called Communities and Schools of Appalachian Highlands, which is going to oversee the operational management and implement this within 50 area schools ranging from elementary to high school. So this is a regional prevention, far-reaching program. So each locality is pledging to provide support. This is an $840,000 cooperative funds award, but I believe there was some significant matching funds that came along with this.
It's a total $1.3 million project, and they're bringing in the rest, so
Yeah.
they're close to.
And even though they've made a lot of traction on projects in far Southwest Virginia, they are still severely affected by the epidemic. Next, we move to Roanoke City, 4 Truths Recovery, Pregnant and Postpartum Women's Implementation Expansion. So 4 Truths Recovery has launched a peer-led recovery time specifically for pregnant and postpartum women. So this is an area where the board is focused on awarding projects and providing supports throughout the Commonwealth. It's Virginia Association of Recovery Residents, this level 2 home. It's also modeled after the Roads to Recovery program in Lynchburg, which we also have a project with, an individual project through Lynchburg City on. And they're using best practices in standard recovery housing, initially serving 8 women and children. And so we're actually doing this as a pilot project for 1 year. And initially this came in as a larger ask. However, the 4 Truths Recovery, who would be the partner and subrecipient, is still very new. And one of the things that we evaluate programs on is working with organizations with an established record of success, because they had not been established very long. But we like that there's this postpartum women focus that they have. We've started off with a pilot project, and if they in the disclosure perform well, then they will be more eligible to receive funds in the future. In other cases, we might have had to recommend a denial of this project, but we thought if the board the grants committee would want to support this project because of its focus specifically on pregnant and parenting women. So they are up and running, and this will help them with their operations and whatnot. And if they do well, they will be coming back with capital costs increase requests, in future years to add more, homes to their program. Did I cover that one right, Sam?
Yeah, they're also, restoration house still take, the continuum of care. They can go to this recovery home after they finish at restoration house.
Yes.
For that program.
They are.
It's like a step down. They went to, they're already at 8 and they're gonna look to go to 12 very quickly. So they were off and running very quickly. So we really
Yep.
wanted to recognize some support.
Another Roanoke City program, what's the next one? Navigator Care Specialist, this is to hire 2 Navigator Care Specialists in the city of Roanoke, partnering with Roanoke County and the city of Salem. They're gonna support and assist clients for whom opioid use disorder is the primary area of need, clients are usually parent and guardians involved with child protective services or foster care. The Navigator Care Specialists will develop treatment relapse prevention plans focused on opioid use. But also include personal, social, health, and economic needs as part of a comprehensive plan. They identify needs and counsel families, addressing specific areas of attention or issues concerning keeping children safe in their own homes, with a focus on relapse prevention as well for parents. And then next, also for Roanoke City, we have harm reduction. So the Virginia Harm Reduction Coalition, which is a certified harm reduction organization in the Roanoke area, is operating beyond capacity, is struggling to meet their demands. Richmond in Roanoke City, and so this proposal is seeking to enhance their harm reduction efforts by expanding mobile outreach in Roanoke County, adding an additional site in Roanoke City, and improving care navigation with participants. And they are also doing some work out of this organization in Franklin County, which is part of the West Piedmont Health District. And they're also enhanced their HIV and hepatitis C testing and their navigation services. And there's a decent, I believe, this is not a very high ask, it's $51,000 because there's a decent bit of matching funds coming with this one. All right, Wise County. Strong Futures, Southwest Virginia, residential center. Provide comprehensive substance use disorder treatment for women, Southwest Virginia, focusing on pregnant and lactating mothers. Valid Health is involved with this project, is contributing matching funds for operational support for Strong Futures. They are looking for various funds to help with the initial capital, to renovate the 4th floor of County Regional Medical Center to establish a SAM 3.5 and 3.1 residential substance use disorder treatment services. And so this program is going to offer holistic services to enhance family dynamics, prevent foster care placements, and foster a healthier environment, safe housing for women and mothers, allowing the children to stay within their treatment, outpatient services, referral, training in employment, parenting, job training, financial management, and there will also be support for Strong Stars childcare, necessary medical care, and enrolled school-age schools. And this program is already up and running in Tennessee. So there is a proven model, benefited over 550 families. 95% of the pregnant mothers enrolled in the program delivered babies free of neonatal abstinence. So there's some clear results. Moving on to Danville City, Recovery 360. Providing wraparound support for opioid use disorder treatment in Danville and Pennsylvania County, led by their community services board. Will add prevention specialists, and implement some evidence-based curricula in local schools. Specialists will also run developmentally appropriate EDIs with community organizations like their housing authority, youth groups. Funding's covering costs for workbooks and supplies, and develop, an annual conference organized by the Regional Alliance for Substance Abuse Prevention. And it's gonna also provide wraparound supports, with individuals diagnosed with opioid use disorder and enrolled in the Danville, Pennsylvania treatment court, which is also supported by individual distribution
equal
grants,
account.
one with Danville, one with Pennsylvania. And this is a second run for Danville and Pennsylvania County. They had a project that came to us last year that was very large in scale and very, very costly that our budget could not support. So Cindy worked with them over the last year to kind of refine and come back with something that was more easy for them to implement and more easy for us to do. And hopefully that this rolls off, they can add additional components as they go along. Next, Henry County, Piedmont Community Services Lighthouse Program. And this is another one that was, had come to us last year as a very large project that had a lot of out-year costs that we could not budgetarily support. And I've been working with Henry County and Martinsville, as well as community service board people to try and help define this. It is something that's a little easier, a little more iterative. But it's going to expand capacity to support people undergoing emergency psychiatric cases, averting more clients from undergoing voluntary inpatient hospitalization, trying to support a true full crisis continuum for all community members in need of immediate access to mental health and substance use care, act as a diversion for the needed individuals going to the emergency department of the criminal justice system. It's going to be house 4 individual offices, 12 bedrooms, full kitchen, observation station, and it's being co-located with an already established crisis support unit within the crisis center. And so there'll be some sharing of staffing to help with the economy of scale on that. And this is going to add staff and process to allow them to be able to see anyone that needs to be seen. I believe this will also have the ability to see children as well. It'll have a separate section for children from the adults. And this is a really wonderfully put together project financially. It has a very large cost in the first year of capital. It doesn't have any match, but its out years significantly reduced because of the adding and billable services to help support and so it goes from it's about a $1.2 million ask this year to a $700,000 ask next year to a $100,000 ask in year 3. And by that point, the project will be self-sustaining. So these are the types of projects that we can really support. So it's an excellent budget home they put together. And last for Region 3, we have Martinsville City Overdose Spike Response and Harm Reduction Access. So they will also be partnering with the Virginia Harm Reduction Coalition that I mentioned about the Roanoke project. So they are beyond their capacity down in this area of the state, which is contiguous: Roanoke City, Roanoke County, Franklin County, Henry County, Martinsville, all together right down Route 220. And so this is going to extend access to naloxone, launch a response plan that's going to be based on the successful one from Roanoke, developing a day shelter and housing case management for unhoused people who use drugs. And they've had some good results with those. They have been able to engage with in the community. And this is designed to be a 2-year project at which they are hoping to seek support in the localities for longer term funding. And I should have mentioned the Henry County project is being recommended out of the unrestricted because it's a primarily project, as well as the Wise County Strong Futures. That first year of that is capital. Those 2 are also being recommended out of there. Moving into Chesterfield County in Region 4, their COMPASS program, Comprehensive Opioid Management and Patient Assistance for Substance Support. is a new program and a complementary piece to something that most of us are familiar with. Chesterfield County's existing smart and HARP programs. So what this ultimately is going to do is add capacity to Chesterfield Jail to be able to see anyone who has been identified as suffering from a substance use disorder and has that comes through their program. Right now, it's kind of limited to those who have a pre-existing prescription for medication for opioid use disorder. This will expand their capacity to be able to help anyone who comes through and is identified as having or being at risk, being able to get them through their treatment recovery program. Next, we move to Prince Edward. They have a regional jail recovery program that they're working on based on the McShin model. They likely will be partnering with McShin, but with the procurement process. And this will be based on some successes about 4 programs implemented in Monkey and Riverside regional jails, Richmond and up into the valley, Shenandoah Valley as well. Pod area dedicated to those seeking recovery from substance use disorders, and they'll get participate in a full program curriculum, including recovery coaching, peer supports, re-entry classes, as well as medication therapy. Another Prince Edward County project. These will be new. The first time Prince Edward have and they're partnering with Nottoway. They received an individual award to do some planning. This will be the first time they have come in as a cooperative fiscal agent, and this will be Nottoway's first engagement with us as well. So the other is Piedmont Health District's Opioid Prevention Connection Project. It's going to add a peer recovery specialist to help provide trusted bridges to high-risk individuals in the Piedmont Health District. And for preventative educational outreach, mitigation of opioid use, morbidity and mortality, and resource connection services. Increases access to evidence-based treatments. And right now, the health district only has one provider trainer, so this expansion will help with that. Chesterfield County, another project for the Recovery Academy that Tony mentioned earlier. They were the first recovery high school in the state. And now they are looking to add kind of an outreach and transportation project. They have people that are interested in coming, but they are far in the region, but they are farther out and they don't have the ability to get there. So this is providing them some resources to try and get those people transported, as well as to outreach in those outer reaches of to help engage others that may be interested. And this is basically based on their what they've learned through their 3 years of operations, where they found gaps in trying to address what are the issues that we're having. And since 2022, they've supported over 60 students in early recovery. Next, we have Enrico.
Charlie, got a question. Charlie. Hey, civilian here again. Can you hear me?
Yes, sir.
Yeah, I have a question about, so is that going to be an ongoing budget request for the transportation? Or do they expect to ask for that through the General Assembly the next time? How does that look in the future?
Adam worked that project. I'll let him answer that one.
Yeah, Mr. Chairman, they being the applicant indicated that they were going to advocate for more funding for that project from the legislature, and I believe it's going to be a recommendation from us to them to not invoke the OAA in making such lobbying efforts on their behalf, and it's certainly their prerogative to ask for more money from the legislature. It was not, and it was included in the Appropriation Act, but I think that's the direction that they're going to take from an ongoing funding standpoint.
Okay, thank you very much.
Yes, thank you, Senator Anya. So there are 3 recovery high school projects that we have recommended funding for. The one for the region we're in now that I mentioned earlier, it's a new project. It's a new project. The Chesterfield one that I just mentioned, and there's also one for the Virginia Beach area. And with all of those, they all have the same contingency about not using OAA funds to be tied to legislative advocacy across the country. They have their own operational budgets to put together and figure things out, but we are not trying to be in a place where we're funding a bunch of projects that are gonna turn around and people go to the general assembly. But I think for Chesterfield here, they're trying to use the opioid abatement funds to create a proof of concept that with evidence before they try to go ask for funding, so that it's not a, hey, we think this works.
Yeah, it's a great, all those schools are great schools. I just, for anticipation of what we can expect in the future as far as requests, both through the OAA and the General Assembly, it's just good to know those things and to know what the expectations might be.
100%. All right, moving on to, almost there, page 8 of 8. This is another Chesterfield County project. This is creating a family engagement for Chesterfield. This is creating a social services, family engagement, and substance use disorder team. Really focusing on coordination of care for pregnant and parenting women with substance use disorders, and their relatives who are supporting their children, models aligning with best practice recommendations for cross-system partnerships, with a number of evidence-based practices cited for that. They wrote a lot, and there's even an attachment to this one. That's gave a lot of trying to see it. And families be benefiting from the supportive services of a case manager, peer support, and a cohesive approach to treatment, navigating resources, accessing services, responding to the needs of children who may have been exposed, and along with kinship resources. All right, Prince George County Mobile Overdose Unit. This is another locality with partners that came to us last year with a large project. We weren't able to recommend funding through the cost, and they whittled this down. Jenny's worked with them a lot over the last year to get this into something that's more implementable and more cost conscious. So this is just basically creating a mobile overdose response unit. Partners is Prince George, Dinwiddie, and Hopewell and Surrey, partnering with the District 19 Community Service Board, which does serve more than those localities. I think they hope as they work with any project that District 19 is a part of, they want to expand to their whole service area, but some areas want to see things get implemented first before they add on to it, some of the localities too. So they'll be providing timely access to substance use treatment, medication assisted treatment, peer recovery services, harm reduction kits, and resources. Back to Henrico, hospital liaisons, pregnant and parenting women. So this as well as the Chesterfield program I mentioned earlier, is focused on pregnant and parenting women. This came out of a planning grant that Henrico, Hanover, Chesterfield, and Richmond got in to try to figure out how best to set up services in the kind of greater Richmond area to support pregnant and parenting women with substance use disorders. So this is a new program that's going to that was, and the analysis was done by VCU's Wright Center for Clinical and Translational Science. None of the 4 localities were receiving referrals from hospitals. Was required for pregnant and parenting women, substance use disorders, and so what these liaisons are going to do is increase the number of referrals. You're going to include hiring 2 registered nurses to serve as liaisons between the hospitals, community OBGYNs, Department of Social Services, and the community service boards. The 2 RNs are going to provide education to those in the medical field about the requirements for referring treatment, substance use identification, trauma-informed practices, and benefits of early intervention to avoid neonatal abstinence syndrome and provide proper care. They'll also be working to provide more handoffs to the community resources and community service boards for treatment as required. Thanks. All right, Colonial Heights, the City of Refuge Transportation Plan. So the City of Refuge is currently a faith-based drug recovery center in Hopewell. And so this is Colonial Heights, Hopewell, the City of Petersburg City, all working together. And Hopewell has put a lot of their direct distributions into funding this program. This is going to be a transportation addition. So much like the Chesterfield Recovery Academy, this is about getting people to the city of refuge here center so that they can access recovery and support services, detox services, job training, medical assistant treatment, and other specific needs. And then finally, the new cooperatives, Virginia Beach City, working with Norfolk, Chesapeake, Portsmouth, and Suffolk. This is the superintendent's Region 2 Recovery High School, which we call the Harbor Hope Center. And this is basically providing some operational support, helping fund the clinical side of the recovery high school staffing. And this was one of the ones I think Tony mentioned that the General Assembly put funding out for Loudoun County area and for the Virginia Beach Tidewater area to be the next two localities. So they have a small ask this year because they have a lot of General Assembly funds that will be expiring, so they're spending those first. So their ask in year 2 will go up, but then they are increasing their matches in their out years. So in years 3, 4, and 5, those operational asks decrease the way we ask. We try to, I should say, coach our applicants to do to help support our budgets. So, any other questions on new cooperative projects? 21. There, okay. Now on to the last slate of recommended awards. These will be Operation Stop awards. So there were 7 localities who were identified through the data where they had while overdoses nationally were going down, there's a spike in like the Black and brown communities going up at the same time. And so these 7 localities were identified by data OAA got from the Department of Health as the highest, having the highest rates of that. And so all 7 did submit proposals. And so that's Richmond City, Henrico County, Petersburg, Chesapeake, Newport News, Norfolk, and Portsmouth. And kudos to Jenny, because she worked all of these applications because her region had 5 of 7 already. So for consistency, it made sense. But each one of them has a slightly different flavor. Each one of them also has to partner with a community partner. So Norfolk is creating a cross-sector partnership between empowered communities, the Norfolk Department of Public Health, and the Norfolk Opioid Coalition and the People's Pharmacy. Chesapeake is working with their Health in Chesapeake organization, who will orchestrate the efforts led by additional community agencies. Henrico has their Empower Task Force that will be working with them. They'll have a data analyst to help pull everything together so that they can put together like various types of outreach events to help with the overdose. Petersburg is going to be working with, well, they already have a relationship with George Mason University for the Howard Communities, as I mentioned before, with Norfolk, as a community organization to help with MOUD Bridge program. Richmond City, their opioid response team is going to be working with Health Brigade, which is a large nonprofit provider in Richmond area. Portsmouth is working on a comprehensive harm reduction program that's both fixed site and will include a mobile van. It does not need purchased capital funds. We're not eligible for the Operation Stop. They are leasing the van we're doing that with, and they are partnering with Healthy 757, as well as using some Unite Us data. And lastly, Newport News, implementing comprehensive strategy, building community-based organization capacity and outreach. And Jenny, do you remember who their community partner was? I
think it's their, health department and to this.
Working with their health department, they're also gonna have the media and education campaign. And try to help get people connected to wraparound services with their community-based organizations. That's I can pull it up the details later if I'm curious. So, any questions on the operation staff awards, and to note those were being, as Adam talked about earlier, they're being funded out of.
If I could just add a comment, Madam Chair, about Operation Stop. Members of the board may recall that when we met last year in November, that Senator Pillion introduced an item for the board to vote on, directing the staff to come up with something. And so we came up with after consultation with members of our grants committee, we came back to you in January with a plan that Charlie is now presenting. The grants committee approved that plan. We were very pleased to get the interest from all 6 cities and 1 county on this. And I can tell you from the travels and conversations we've had around the country, we're getting a lot of questions because we haven't seen any other state that's taking opioid settlement funds and specifically targeting the community that's currently having the highest rate of opioid overdose death, which is your low income, particularly urban Black community. And so there's a lot of eyes on this. We're very excited about the possibility that these 7 cities, counties have come up with. And really, this is just the beginning, because as they go to implement these efforts, we're going to be there with them to help them. And, you know, one of our state agency partners that we've been providing funding for the last couple of years, VCU Right Center, they've come alongside us in this. And one of the requirements that we've put together for these 7 recipients is that they have to all jointly participate in periodic meetings that are going to be hosted by VCU to compare with each other what they're doing, what seems to be working, what kind of challenges do they have. And so I'm interrupting Charlie on this because I think that the board and the grants committee in particular can be, this is something we can really highlight as something different that the OAA is doing, that Virginia's doing. Personally, I'm excited about the prospect. Thank you.
Any questions on the operation stop proposals? All right, one more slide. Next, it doesn't stop after today. We've got a lot to do. So you can see proposals. They closed on the 27th of May. We received 43 projects across 18 agencies. We're going to be reviewing and working with them to develop recommendations that this committee will hear at their August 1st meeting, which is all virtual. City and county grants. And we've got award packages that will be going out all through the system for these. Then we will move quickly into our carry forward true-up process that will happen later in the summer once the fiscal year has closed. And then after that, the grants that are ending in June, their annual reports will be due in September. One other thing that I wanted to mention is that we are looking to update how the cycle runs. As I mentioned, we've done it on this October to April type of timeline, because it makes sense based on many things happening in city and state governments, city, county, and state governments. However, as we've learned lessons and also as we have implemented our system, we're looking to revise that to run about August 15th to March 15th. That will give significantly more time for applicants to get projects together and also provide the ability. We now have a grants committee meeting in September that we didn't used to have, and we're doing a joint one in November along with the board meeting. And it'll give them a chance to get current year awards earlier and also make amendments, if they need to through the process. And ending it a little sooner will give us a little more time as these grants get more complicated and as you all make a notice from looking at the level of details that we're able to get into the recommendations now. There's more and more work and we could use a little more time. And also it'll help, a lot of times things get caught up in the localities because right at the end of March, beginning of April, they're finishing their locality budgets. So getting a little bit ahead of that, I think will make it easier for that as well. So, and this will also better align with our advice committee.
I just want to express my admiration and thanks to all the staff and just for the excellent work you've done to get us to this point, especially with the number of grants that you have been able to process in such a short period of time. I'm sure I speak for the rest of you guys as well. Thank you.
I don't know how you do it with such a small staff. A lot of hard work and dedication and support, everybody supporting everybody.
Well, and I think our transparency, the way you present to us, everything is so open, for anybody to look at. It's really gold standards. Want to be.
If I could make a note, we did get kudos for when I was at, I believe at the RX Summit about our meeting notes, which is a big kudos to Kara, that someone who is with a nonprofit organization that works nationwide was trying to find something and they couldn't find it through the budget. And they found it in our notes because they knew we covered those types of things. So people are using a lot of resources that we're putting out. They were they wanted to come up and tell me in person how appreciative they were of that. So
Nice. Great. Glad to hear that. You're hearing feedback from the rest of the country. Well, we will move on to agenda item number 5. This is the time on the agenda where members of the public may address comments to the committee. We do request all comments be kept to 3 minutes or less. To indicate that you would like to speak, you're in person. I don't know if we have a sign-up sheet or you can just raise your hand. That would be just fine. And I'm not sure how many people we have online that are listening in, but if you would like to speak, just click your raise hand button and Kara or Matt will call your name and enable you to speak one at a time. Do we have anybody that would like to make a public comment? Not online. Okay. Not seeing any, we'll move on to our agenda item number 6, our new business. First item under new business is for our grants committee to consider awards that were listed on attachment to our agenda. These are the recommended awards to cities and or counties where no member of the grants committee has requested to abstain due to a possible conflict of interest. So I will now entertain a motion to approve the block of awards consistent with staff recommendations. Do I hear a motion?
So moved.
Okay, so our motion really is to, I'll just reiterate, approve the block of grants from the city and county awards for renewal amendments and or new grant awards recommended for approval by staff that we had in attachment A. This is where we didn't have anybody that needed to abstain. So I have a second. Thank you. All in favor, please say aye. Any opposed, nay? Okay. And we're approved unanimously.
Good job.
All right, next item under new business is for our committee to consider the specific awards listed on attachment A where a member of our grants committee has requested to abstain due to a possible conflict of interest. So I'll now entertain a motion to approve the awards consistent with staff recommendations for which Mr. Spencer has requested refusal. Do I hear a motion? So moved.
And if I could just real quickly, I really want to commend, you'll see it on the screen. Putting this together and listening to this is very transparent and extremely helpful to demonstrate that I must recuse myself under 2.2-3112. Check me if I'm wrong. under the Virginia Conflict of Interest Act, because I'm an employee of the city of Raleigh. These specific grants involve the city of Raleigh.
Thank you for that explanation in detail. So I have a motion to approve by Mrs. Button. Do I have a second?
Second.
Thank you, Mr. Tillman. All in favor, please say aye. Aye. Any opposed? And one abstention. Okay, now I'll entertain a motion to approve the awards consistent with staff recommendations for which Mrs. Buckman has requested refusal. Do I hear a motion?
So moved.
Mr. Spencer, do I have a second?
I'll second.
Very much, Mr. Tillman. And, for the minutes, the same details that Mr. Spencer said apply to you, is that correct?
Correct. These awards, will fund programs that are operated by my employer.
Okay, great, thank you very much. Okay, so we have, motion and second, all in favor of approval, please say aye.
Aye.
Any opposed? We have one abstention. Okay, next item for new business is for our committee to consider the block of operation stop awards for our cities and counties as listed in attachment A of the agenda. And no member of our grants committee has requested to abstain due to a possible conflict of interest. So I'll entertain a motion to approve these block of awards consistent with our staff recommendations. Do I hear a motion?
So moved.
Mr. Spencer, do I have a second?
I'll second.
Very much, Mr. Tillum. All in favor, please say aye.
Aye.
Any opposed, nay? That was unanimously approved. Okay, at this time, I'll entertain any other items of new business or motions from the members of our grants committee. Want to have anything else for discussion?
If none of the members have anything, I can't not chime in and express my appreciation for the team and what they put together. Ms. Sharika Bridges is not with us today. She had to attend to a family event and she's in Africa, she's in Nigeria, which means we're 3 people short. Sharika's like 3 people. But Sharika, Charlie, Cindy, Kat, Jenny, Adam, the whole team, everybody, this was an all hands on deck effort. They put forward an incredible amount of time. We're really fortunate that our board of directors has implement the grants management software system, the platform that we recommended. It was not inexpensive. If we hadn't have done that, we would not have been able to meet the timeline and to process all of these grants. And we were really getting at a risk prior to that of with so many spreadsheets involved that I was nervous about keeping track of the finances. And so kudos especially to Matt for helping our vendor to get that system up and running. Not only is the grants application system, but it also provides the financial back end. You know, we're going through an audit right now from the state, and so having access to a system like this has made all the difference. And as the grant board packages go out, they will go out through the system. And so we've been fortunate to have the support of the board and the grants committee and making all this happen. And the last note that I want to make is that if you do the math, it just so happens that with the action that you just took, the approvals you just made, the OAA has now approved the award of $99 million since day one, which is a little, I'm almost disappointed. It's like, can we just come up with $1 million more so we could get a square round off 100 million? But I think that's an amazing feat. Everybody here should be proud of. I mean, that's more than, a total fund that we expect the OAA to administer over the life of the settlements. It's about 600 million. So we're at, I don't know what that percentage is, but almost $100 million out of 600 million in 2.5 years is a remarkable achievement. So I'm proud to be part of it. So let's leave you with that.
And August 1st, we'll break the barrier. The 99. State agency record.
Okay, well, we have come to our last item on our agenda, which is the motion to adjourn. I have a motion to adjourn.
So moved.
Hey, go a second.
I say.
Okay, everyone in favor, please say aye. I didn't hear any nays. Okay, we are adjourned.